Septicemia. Remember I said septicemia when I did the definitions or terminology here. Septicemia is a generalized condition when microorganisms are not only present in the blood, but they're actively multiplying. It can be caused by many different pathogens. It's not just this one thing does it and that's it. Patients suffering from this condition are said to be septic. So if you've ever watched any type of medical show drama, they'll talk about, a patient being septic. This is what they're talking about. The reservoir or transmission route, it can arise from multiple pathogens or routes, and it can be caused by microbes from a lot of different sources: human, animal, soil, even water. And it can be directly introduced via medical equipment. We talked about nosocomial infections and how most of the time they're polymicrobial because of biofilms. It can be caused by an increase in severity of other infections. If you have a UTI, if you have meningitis, this can progress into septicemia. Signs and symptoms. Usually they'll have a fever and they'll have low blood pressure. These are kind of the main symptoms. Remember that if you get that cascade of immune response, your blood vessels are going to leak. And if this happens all over the body, your blood pressure is going to drop. Your breathing rate increases. If your blood isn't flowing at a good rate, it also means that it's not carrying oxygen like it's supposed to. It feels like you're not getting enough oxygen, so you start breathing a lot more often because your blood is not carrying the oxygen like it's supposed to, because your blood pressure is so low, it's not flowing as fast as it's supposed to. Other symptoms include things like altered mental state, shaking, chills, nausea, even vomiting. Pathogen. Because I just said a few minutes ago that it's different things, this is very general. In most cases, it's some type of bacteria, but there are a small percentage of cases that are actually fungal in origin, and in some cases, it can even be polymicrobial, like the nosocomial infection I just mentioned a few seconds ago. Pathogenesis. The bacteria are multiplying in the blood. They can release antigens, endotoxin for gram-negative, and teichoic acids and lipoteichoic acids for gram-positive, which instigate an inflammatory chain reaction. Remember that the inflammatory response is several things happening. It's a series of reactions. If these things are in the blood, it can basically cause that chain reaction systemically through the entire body. Treatment. Well, initially, if we don't know what it is, we're just going to give you broad spectrum antibiotics. We want to start something so that hopefully it'll get treated. Eventually we will culture, we'll figure out exactly what it is so that we can actually give you targeted antibiotic therapy. But in the beginning, I just want to get something started. So we start with broad spectrum. Prevention. Good aseptic technique in hospitals. Keep primary infections from escalating. Remember I said the severity of other infections. If you're sick and you know you're sick and you're not really getting any better, maybe you should go to the doctor and say, hey, so what do you think? They say, oh, this is bacterial. They'll give you antibiotics and poof, you're done. But don't let it progress to the point that it actually becomes septicemia. So in this case, this man has an infected tooth that he just kind of lets go and lets go. Eventually it abscesses and the bacteria go into the bloodstream. So the bacteria from the abscess migrate to the bloodstream. The bacteria is carried through the bloodstream to major organs, making them sick. Now remember, this blood goes everywhere. It's in the heart, it's in the lungs, it's in the liver, it's in the kidneys. Your blood goes everywhere. So now I'm carrying this bacteria. Anywhere I go, the bacteria can get to. Blood clots will form throughout the body, and that actually depletes the available blood clotting factors. The body cells become poisoned. We call this blood poisoning. And sepsis will cause a whole body inflammatory state called systemic inflammatory response syndrome, or SIRS. Your whole body going through an inflammatory response is devastating. It's not just happening in your finger and your foot. It's literally happening in every blood vessel that you have. That can lead to septic shock, which can lead to multiple organ failure, which can eventually lead to death. Sepsis is not something to play around with. When you're septic, they want to treat it, and they want to treat it right now because it can potentially kill you dead. The plague. The plague itself has killed hundreds of millions throughout history. It's responsible for multiple pandemics, including the Black Death, which wiped out 60% of the European population in the 1300s. Imagine 60% of the Texas population dying. That's what this is. This is something that when the Black Death hit, it was awful. It was terrible. So depending on what kind of plague you have, it kind of determines what signs and symptoms you will see. Bubonic plague will cause inflammation and necrosis of the lymph nodes, causing extremely swollen lesions called buboes that can be accompanied by chills, fever, headache, nausea, and weakness. Septicemic plague, we just talked about septicemia, right? It's where bacteria have spread to the blood. They cause subcutaneous hemorrhage, which leads to darkening of the skin. This is the one that has the highest mortality rate. Septicemia is not something to play around with. Pneumonic plague. So think pneumonia. This is caused by the spread of bacteria to the lungs, usually via the bloodstream, or it can also be from directly inhaling the bacteria. This causes, of course, respiratory symptoms because you are breathing it in. So what's the pathogen? Yersinia pestis is going to be the pathogen. It is actually a member of the family Enterobacteriaceae. This includes things like E. coli and Salmonella. Pathogenesis. The thing with Yersinia pestis is it has a very small infectious dose. We're talking 3 to 50 cells. That is not a lot when you're talking about something that's microscopic. 3 to 50 cells can establish an infection in a person. The bacterium will commonly enter the skin through a flea bite, and then it's circulated throughout the body. It can get trapped and infect the lymph nodes. That's when you get bubonic plague. If it goes to the lungs, you get pneumonic plague, or it can continue to circulate, continue to go through the blood, in which case we've got septicemic plague. Treatment. It is a bacteria, so we can use antibiotics. Prevention, flea control, animal control. There are vaccines available for those that are at high risk of contracting the disease. If you know you're going somewhere where plague is prevalent, you can get vaccinated before you go. So bubonic plague, you can see the swollen lymph nodes. The buboes themselves are swollen, they're painful, and usually they are warm to the touch. There will be a sudden onset of fever and chills, a headache, you have fatigue, you're tired, you don't feel well, you have malaise, you just can't really move around that much, and you have muscle aches. During the bubonic plague, doctors used to dress like this. I know, you think it looks ridiculous, he looks like he's a bird. Well, there was a reason. They had this mask that was made out of leather that also had glass coverings on the eye holes to try and prevent it from getting to their face. The beak did two things. One, it was long enough that they weren't right next to somebody breathing, but two, they used to stuff this thing with herbs and spices. Because of the sheer number of people dying, it smelled terrible. So it was a way to hopefully lessen that smell. The gown that they used, they would basically soak it in wax. And the reason they did that was because they were trying to prevent things from going through to getting to their body. They would have leather gloves and they would have full-length boots. It was a way to cover their body from head to toe and, in this case, hopefully prevent them from contracting it. Something else that was, in my opinion, kind of weird, they would usually carry a wooden stick to help keep sick people away. So they would push people away from them. As a doctor, that doesn't seem really to follow the Hippocratic Oath, but yeah, there you go. This is septicemic plague. Person will have fever and chills, and they will experience shock, abdominal pain, diarrhea, vomiting, bleeding from the mouth, the nose, the rectum, and under your skin, blackening and death of tissue in your extremities. In septicemic plague, I mentioned the subcutaneous hemorrhage. There is damaging of blood vessels, especially in the extremities. That damage means that as the blood vessels break, you hemorrhage. but there's not really blood flow. You're not getting oxygen to the tissues and you're not carting away waste. So eventually these tissues start to die. This was called Black Plague because they would lose parts of their body, and before they lost them, they would turn black. Blackening and death of tissue in your extremities was pretty much the common link in septicemic plague. In pneumonic plague, again, this is when it gets into your lungs. You have high fever, you experience weakness. There will be signs of pneumonia, including things like chest pain, difficulty breathing, and a cough, usually with bloody sputum. Remember I said it causes hemorrhage, so bloody sputum is part of that. They'll also experience nausea and vomiting. If you look at the x-ray, you can see that there is definite difference between this person's right lung and their left lung. This lung is full of fluid, so the x-rays aren't going through it like it should and blackening that x-ray film like it should, meaning that this lung has pneumonia, this one doesn't. Tuleremia, which is also called rabbit fever, and it's literally called that because one of the common reservoirs is rabbits. It's not really super common in the United States. There are only about 200 cases a year, but the reservoirs can include rabbits, rodents, other small mammals like skunks and beavers and foxes. It is considered a zoonosis, kind of like rabies is. The transmission route is usually direct contact with infected animals. Generally, we're talking about during skinning. So if you hunt a rabbit and you skin it, it can be vector-borne through ticks and other arthropods, and you can transmit it via aerosolized bacteria. So when you skin a rabbit and you rip off the skin, it can aerosolize the blood and you can inhale it that way. So the signs and symptoms include things like backache, fever, chills, malaise, weakness. Symptoms can progress to other manifestations. It just depends on its portal of entry. So ulcerative skin lesions. If it comes through an insect bite, you can have ulcerative lesions. Swollen lymph glands are another symptom, which you can see here. That's a lymph node that has been swollen in her neck. Conjunctival inflammation. So your conjunctiva is the pink part of your eye in here. If it gets in your eye, it can cause infection there. Sore throat and pulmonary involvement via inhalation. So remember I said if you aerosolize it and breathe it in, it's going to cause a sore throat and your lungs are going to get involved. What's the pathogen? Francisella tularensis is a gram-negative bacteria that causes tuleremia. A small infectious dose is all that's needed to cause an infection. Once the bacteria has entered the bloodstream, it circulates and eventually symptoms start. Treatment, it's a gram-negative bacteria, so we do have antibiotics. Prevention, if you are handling wild animals, take precautions. Even when they're dead, doesn't matter if they're dead, you still need to take precautions. And there is a vaccine available for high-risk individuals. So if you are animal control and you know that you work with wild animals, even if it's picking them up off the road after they've died by getting hit by a car, you can get a vaccine. And if you know that that's an issue, getting a vaccine is probably a good idea. This is what Francisella tularensis looks like as a 3D rendering. Lyme disease. I'm pretty sure we all know about Lyme disease in South Texas because we have a lot of deer. And Lyme disease is found in areas with particularly high deer populations. The majority of the cases in the United States actually happen in the Northeast and in the northern Midwest, but the reservoir include deer and mice. The transmission route is actually vector-borne through the Ixodes tick. Signs and symptoms. The earliest symptom is the bullseye rash, also known as erythema migrans. In 70% of cases, you are going to see a rash that looks like this, with a bullseye in the middle, a ring, and then a red ring around it. that rash is a huge clue that you have Lyme disease. So first stage symptoms, things like fever, headache, stiff neck, dizziness. If you get to the second stage, you're going to have cardiac and neurological symptoms. By the third stage, you're talking about having crippling arthritis. You're going to have severe joint issues. The pathogen that causes Lyme disease is Borrelia burgdorferi, which is a spirochete bacteria, and it actually has complex nutritional requirements. You can see it here, Borrelia burgdorferi, the spirochete. It enters the bloodstream via the tick bite. It circulates through the blood or the lymph, and eventually it causes symptoms. While in the bloodstream, one of the things that is scary with Lyme disease is it evades our immune system through antigenic variation. So you know how we have the foreign antigens and our body recognizes them and that's how it attacks it. Well, with this particular spirochete, it keeps changing the surface antigens, meaning that it is really hard to find. It is really hard to find because if it keeps changing, I have to keep coming up with different immune responses to it. Treatment. There is prolonged treatment with antibiotics. A lot of people won't take a 7 to 14 day course, so prolonged treatment probably not really likely. There is a vaccination in development. Other prevention includes wearing protective clothing if you are in a place prone to having ticks. When you are done, check your body for ticks after leaving that area. The longer the tick is attached to your body, the better the chance it has of passing Lyme disease to you. If you catch it early and get it off, the chances are lower. Are they zero? Not necessarily, but they are lower.